Hi, my name is Jessica Marks, and I'm representing methods for treating communication apprehension. There's two. You can do the systematic desensitization and cognitive restructuring. Although these are solutions for more severe cognitive of communication apprehension, there are some tips for people with less severe, and I'll kind of just give you a couple tips here at the end. The first one, systematic desensitization, was introduced in 1966 as a method for reducing anxiety. It involves countering the stress you're experiencing, training people to react differently to stress-inducing situations or stimuli. This is done in 3 phases. The first phase, people are taught how to counter the symptoms of stress through deep muscle relaxation. Typically, a trainer will have the individual stress or tense all different muscles in the body and then relax each of them. This helps with being aware of what the muscles feel like when tense and what they feel like when they're relaxed. The second piece of that is the construction of hierarchies of communication apprehension stimuli. You should think of activities that produce low anxiety, like taking a stroll through a quiet park, and then think of the activities that produce higher anxiety, like asking someone on a date. This again is about being aware of the different feelings that are kind of associated when you're stressed or less stressed. The third component, or the third piece, is combining the 2 techniques together. So try focusing on the part of the body where you feel the tension and attempt to relax it. If needed, think of a low stress situation momentarily so you can get your brain to remember how relaxed you felt while doing the exercises with your trainer during your presentation. And then the other suggestion they have is another form of treatment would be cognitive restructuring. This is another common approach to treating communication apprehension. First, you're asked to think about negative statements, like falling on your face, for instance, statements that enhance the stress symptoms of communication apprehension. These are unrealistic thoughts that go through your head prior to your speaking situation. These thoughts are very unproductive and should not be part of your preparation thoughts. Once you have learned to stop thinking about these negative thoughts, you'll be asked to start thinking about positive thoughts. So driving to your presentation, you should be thinking about, I know I'm going to do a great job. Maybe even visualize yourself at the end smiling and knowing you did it. That'll probably help a lot. And kind of say to yourself, I will speak slowly. I will get the message across. And then, as I said initially, here's some ways to help manage some common stress of communication apprehension. And this is more day-to-day stress that, the average person has. Develop a constructive attitude towards fear and anxiety. Take every opportunity to prepare and practice for your speech. Remind yourself that the listeners want you to succeed. Consider, but don't dwell on a worst-case scenario. And then kind of plan for what you can do if that takes place. Have positive thoughts and attitudes, and visualize your success as if you had already completed your speaking assignment and left patting yourself on the back. Use relaxation techniques as previously discussed. Just relax yourself, and if you have to, take a breath and picture yourself in a more relaxed setting. That could help too. And remember, people are judging the content of your speech, not you. And good luck. I just use these techniques and think about what your thoughts are on right now. Are you thinking about me and how I present it, or are you actually thinking about the information that I sent across? And then, 10 minutes from now, what are you going to be thinking about? Probably not me. And so I just have to remember that when I'm in front of a group of people. Thank you.